Been there for about 7 years now, close to at St. Augustine's when we moved from our original location in Belmont. We operate about 3 dialysis machines there right now. There's a need for more. We have the equipment, but we've been trying to find the correct location, the best location, which has always been nearest to the hospital. And this recent year, through networking and conversations with people, we found the diocese who owns this or controls this property, and that's how we ended up starting work on this immediately as soon as we got the okay for that. We'll be operating 5 machines here at one time to begin with. We have capacity up to 8 to run 8 at the same time. We'll have backup equipment for all those as well, which will be stored at another location. St. Augustine's will still have access to dialysis, much smaller. We'd only keep 1 unit access up there, so it'll be private care. Patients who prefer a private room, or tourist patients who just want a private room, their family could come and stay with them while they're being treated. The hospital would be more for acute care. I know the hospital is also putting in their own HD unit in the coming years and aligning with National Health Insurance. I think that's a very good move. I'm hoping we as a country, get it organized correctly, but we could only do that by starting. It's one thing that would seed investment in healthcare. In Grenada, we need a lot of specialty healthcare, but it's expensive to start. We've been in 13 years now, and it's taken a lot to build it block by block by block, because there's no holistic payment mechanism for any investments in healthcare, whether if it were oncology or anything else. Something like National Health Insurance now allows an investor, whether in a healthcare investor, a doctor, or just a private investor similar to myself, to then calculate and project the possibility of setting up a cancer clinic, or possibility of setting up a rehabilitation or anything like that. So it's good news. About 40% of patients have private insurance. It's a lot easier for them. Private patients who have to pay out of pocket, it's a high cost no matter who you are. No matter what income status you come from. We help. The Kidney Foundation does a lot of work. The government also does a lot of work, contributes a lot, and we as a company contribute during these past 13 years. A lot of things are going into here. So, in addition to the machines, we have a water system. It's pretty sizable. That purifies up to 100 gallons every 10 minutes. That's zero water. That's no suspensions, nothing else in it. We also have a backup mobile one that we'll keep at this location that would support both us and hospital or St. Augustine's as needed. We're going to get into solar. We have to get a generator as a backup, even though this is a dedicated hospital line. It's been pretty reliable over the past decade, but we can't afford that 2 days or 1 day that it decide, So that's another big investment that we have to take. In terms of us trying to manage the price for dialysis and hopefully possibly reduce it or definitely sustain it as opposed to increase, we're looking to solar, we're looking to inverted cooling with inverters, and anything we could do really to LED lighting and all the possibilities that we can to maintain costs.